Assalamualaikum, we are the members of BA2354B. We'll be presenting the overall infographic of disease of the respiratory system, code range J00 to J99 and U07.0 for vaping-related disorders. Let's get started.
Assalamualaikum warahmatullahi wabarakatuh. My name is Mohammad Haziq bin Romayli. So today I'm going to explain about introduction of respiratory system. The respiratory system is the network of organs and tissues that help you breathe. It includes your airways, lungs, and blood vessels. These parts work together to move oxygen throughout the body and clean out waste gases like carbon dioxide. Next, I will explain about the common disease for respiratory system. First one is chronic obstructive pulmonary disease, acute respiratory failure. The third one is influenza due to certain identified virus. The fourth one is ventilator-associated pneumonia. And lastly is the new common disease for respiratory system is vaping-related disorder.
Now, acute exacerbation of chronic obstructive bronchitis and asthma. What is acute exacerbation? Well, it is a period of unstable lung function with worsening airflow. Therefore, according to the tabular, codes categories in J44 and J45 differentiates between uncomplicated cases and acute exacerbation.
Assalamualaikum warahmatullahi wabarakatuh. My name is Yusuf Bin Md Ali. So I'm gonna present about acute respiratory failure, or in short ARF. ARF has two conditions, which is it act as principal diagnosis and secondary diagnosis. For it to be coded as principal diagnosis is when ARF is responsible for admission to the hospital, and meanwhile for it to act as to be coded as secondary diagnosis is when ARF is present after the admission or on the admission to the hospital. Thank you.
Assalamualaikum, Bismillahirrahmanirrahim. Today I'm going to be presenting for my part, which is influenza due to certain identified influenza viruses.
The influenza codes ranges from J09 up until J18. For this subtopic, we need to code only confirmed cases of influenza due to certain identified influenza viruses, which is category J09, and due to other identified influenza virus, namely category J10. In this context, confirmation does not require documentation of positive laboratory testing specific for avian or other novel influenza A or other identified influenza virus. However, if the provider records suspected or possible or probable avian influenza or novel influenza or other identified influenza, then the appropriate influenza code from category J11 influenza due to unidentified influenza virus should be assigned. That's it for me. Thank you.
Hi, I am Siti Norathirah will present about vaping-related disorder. In the disease of respiratory system, code U07.0 as the principal diagnosis when the patient presents with the condition related to vaping and also including lung injury due to vaping. For additional manifestation codes such as acute respiratory failure, use code J96.0- or pneumonia J68.0 with the lung injury, but not report other associated respiratory signs and symptoms such as shortness of breath. In guidelines stated that it would be appropriate to code separately any gastrointestinal symptoms such as diarrhea and abdominal pain. Hence, there is an instructional note at code U07.0 vaping-related disorder to use additional code to identify manifestation. With the instructional notes, code U07.0 is sequenced first, followed by the manifestations.
Assalamualaikum and good day to everyone. My name is Naim Firdaus bin Walid, and I would like to share some fun facts regarding the respiratory system. Did you know that some people can hold their breath for more than 20 minutes? Besides that, if a lung is flattened completely, the size of the lung could reach almost up to the size of a whole tennis court. And last but not least, the average human breathes up to 22,000 times every day. Thank you.